teach you before you go home with baby, and it's over things for you and baby. Do you have any specific things you want to touch up on or that you might not know a whole lot about?
Not really. It's my first kid, so I'll just take what I can get.
Okay, yeah. So we'll start with bleeding. So bright red bleeding, which is what we call lochia rubra, is normal after postpartum. It lasts 1 to 3 days. After that third day, it starts turning a pinkish brownish color, and we call this serosa. And that lasts from 4 to 10 days. And then after that 10th day, it'll start being white, yellowish, and we call this alba, and that can last up to 6 weeks, which is normal. What's not normal is it going back to that bright red bleeding after being either pink or brown or white. And if this does happen, we ask that you do notify your doctor immediately or seek health care. With your pad, you want to change it every 2 to 4 hours depending on how soaked it is. What we don't want is you changing your pad more than once within an hour. So we don't want you changing it every 15 minutes because you're soaking that. Clots about the size of a quarter or smaller can be normal. What's not normal is the size of lemons or golf balls. If that does happen, notify your doctor immediately. You don't want any odor. So after bleeding, I have care for your laceration. So you did get a second-degree laceration while giving birth to your baby. So with that laceration, you want to keep it clean. You want to wash it gently with warm water and soap after each. Don't scrub it, just pat dry maybe. If it's slightly painful or discomforting, you can do ice packs on and off.
Can I take pain medicine too for that?
Yes, you can. But if you want to try like non-pharmacological measures first, such as ice packs or sitz baths, to see if it relieves any of the pain, you can, and then maybe if not, you can go on to the pain medications. So with ice packs, you want to do it for 15 to 20 minutes. And then with sitz baths, for 10 to 15 minutes, and you can do this multiple times throughout the day. You don't want to directly place the ice pack on your laceration. You want to make sure there's like a barrier between. You want to avoid straining, avoid sex, get plenty of rest, increase your fluid and fiber because it can help with the healing. Some things to watch out for with your laceration are signs of infection, so like any odor, drainage, if you start getting a fever of 100.4 or greater, any redness, warmth, or flu-like symptoms such as chills, body ache, or headaches, you want to notify your provider because it could be an infection. Other infections we like to teach our moms about is mastitis and endometriitis. So with mastitis, if you have an inflamed, reddened breast that's pretty painful, a few ways to help is to massage before feeding because it helps the milk flow, and then cold compress after the feeding. And we advise you to keep breastfeeding on that affected breast. And then with endometriitis, all the symptoms I mentioned earlier and the uterine tenderness can be signs. So we advise you to let the doctor know right away so you can get put on some antibiotics. If you being postpartum, you are at risk for postpartum depression. So postpartum depression is similar to the postpartum blues, like the feelings, emotionally, but with postpartum blues, it goes away within 10 days, so roughly 2 weeks. Postpartum depression can last much longer, and you can eventually start getting feelings, the thoughts of harming yourself or harming your baby. You can get sleep disturbances, fatigue, your appetite decreases, you stop taking care of yourself. And with postpartum depression, we always say sleep when the baby sleeps, to take care of yourself, to get plenty of rest, and to start seeking care when you do get those thoughts of harming yourself or your baby, because it can end up much worse. So thoughts of harming yourself require the need for immediate intervention, so one-on-one, maybe hospitalization, and getting you separated from your baby. That way you can get that time to yourself to heal properly. Other things that require immediate intervention is a large gush of blood or the return to rubra like we talked about earlier, any odor from your laceration or the bleeding, shortness of breath, vision changes, swelling, tachycardia, fever greater than 100.4, any persistent pain in your abdomen or your shoulder, and any drainage, again, that has the bowel odor. That is all I have for teaching wise with you. Before we get into baby, did you have any other questions?
No, I think I got everything.
Okay, so now going into baby, do you have anything specific you want to talk about with baby or that you're unsure about?
I'll just take what I can get. He's my first baby, so.
Okay, yeah, of course. So, with baby, we're going to start off with feeding. Do you plan on breastfeeding, bottle feeding, both?
I'll bottle feed.
Bottle feed? Okay, so with bottle feeding, we recommend that babies be fed on demand. So, if you start noticing the hunger cues such as them sticking their hands to their mouth or hand-to-hand movements, sucking motions, or rooting reflexes, we say go ahead and feed the baby. But if you're not noticing those hunger cues, we say don't let them go longer than 4 hours without another feed. We recommend that you do wake up baby at least more than before the 4-hour mark at night, so maybe like every 3 hours throughout the night. Baby should be eating 8 to 12 times through a 24-hour period. With your bottle, you can run it in the dishwasher. It can be boiled. You can wash the bottles by hand in hot soapy water using a good nipple brush. While feeding the baby, give the baby several opportunities to burp. With your formula, you can use tap water to mix concentrated or powder formula. When you prepare the formula, it can be refrigerated for up to 48 hours. And then do not use the formula past the expiration date on the container. So now going into bathing baby. So we tell moms to not submerge baby underwater until the umbilical cord has fallen off or until the circ has fully healed. So with the cord, you want to wash around it, making sure not to get it wet. You're going to clean from the cleanest to the dirtiest part of the body. So start with the head, clean the eyes, the face, the head, and then you're going to move on to chest, arms and legs, and then the groin area last. Before washing, giving your baby a bath, you want to test the water with your elbow, making sure it's anywhere from 98 to 99. Just making sure that it's comfortable enough for you, that way you know it's comfortable enough for baby. Once you're done washing baby, you want to make sure to dry them thoroughly because of their thermoregulation being off. They could get colder a lot faster, so you want to also avoid placing them next to drafts or windows or ACs or any of that. You want to use clean, clear water to clean their eyes, cleaning from inner to outer with a clean rag. And then to clean their head, you want to swaddle them in a towel or a blanket and hold them in a football hold, washing, rinsing their head. Okay, so then we have our cord care. So with the cord care, you want to make sure not to submerge it underwater. Try to avoid getting it wet. Avoid soap and alcohol. You want to keep it dry, so when putting a diaper on, you want to fold it to where it's not rubbing up against it and irritating it. You can rub it with a small damp cloth or cotton with warm water. You want to check for any infections in it, so any redness, swelling, discharge, or pain. And if there is infection, you can notify the doctor. It typically can fall off anywhere from 1 to 3 weeks. So, going into our circumcision care, so you want to clean it with warm water and mild soap. Avoid any alcohol or hydrogen peroxide. It typically gets a yellow ring around it. Don't remove it. It'll eventually fall off on its own. You want to have frequent diaper changes to avoid any infections. So same thing, any redness, swelling, discharge, notify the doctor. If they have no urination for several hours, this is also another sign to notify the doctor. When doing diaper changes, you can put petroleum jelly ointment to help it keep from sticking from the diaper and causing irritation to it. And then our last topic is safe sleep. So putting baby, you want them to be on a firm mattress, nothing in the crib, no bottles, toys, extra blankets, nothing extra that can cause any suffocation or anything. No co-sleeping. You want them on their back. You want the room temperature to be comfortable for them. You want them to dress appropriately. You want to avoid overheating them, so don't dress them in too many clothes and then so many blankets on top of them. And then you want to breastfeed if possible, to avoid SIDS from happening. Do you have any other questions or any other teaching you want touched up on?
No, I think I'm good now. I feel like I can take care of Tammy and myself.
Okay, well, congratulations